Good morning. My name is Merrick Schaefer. I work at UNICEF on an innovations group in our division of communication. I was a web developer for 10 years before that, and now I try to manage other web developers, which is much harder. For those of you who don't know, UNICEF is a UN agency, not an NGO and not a nonprofit. We support children's development through all sorts of different aspects of their life, child health, nutrition, education. We also work in 186 countries, giving us a truly global scope to our operations. On our day-to-day basis, we work similar to a consultancy. We advise governments directly around policy. We work with ministries. We provide logistical services, planes, trucks, sometimes donkeys. And we also operate on economies of scale due to our global nature. We're known for being one of the world's largest purchaser of vaccines, but we're less known for being the world's largest purchaser of pencils. Today I'm here to talk to you about one specific project my innovation group worked on, trying to find ways changing technologies in Africa could benefit the population of Malawi. It's a small English-speaking country in East Africa of about 14 million people, and we were there to look at how they were collecting malnutrition data for children. This project, like many of the other ones we did in partnership with international relations students, 6 grad students from Colombia, and working directly with the Malawi Ministry of Health. And we were trying to figure out if we could use SMS to improve their data collection. So we went there to model the process that they were using, and UNICEF, WHO, and others have come up with a very, very accurate method of predicting malnutrition. You can take the age of a child plus the height, weight, and upper arm circumference, and you can accurately predict very mild cases as well as severe cases. The process was the healthcare worker would write this information down and send it to the government. There weren't really many doctors or nurses in these places, and they didn't really know what they were writing down. They just recorded the data, sent it off. They didn't use it to diagnose it. So we showed up at the government. We were very excited to build our databases, asking to look at their data, and they said, oh yeah, in the other room, and we found literally this, the data inboxes under desks. So the government really wasn't using it yet either. They might use it later for policy planning or something, but they weren't using it then. So we had a lot of problems to work on. Now, the amazing thing about Africa is that there's been an explosion of cell phone use. There were 2 million phones in 1998. Now there's 500 million. 60% of the people have access to phones overall. And most importantly for us, the healthcare workers we were working with all had their own cell phones. We've built an open source framework for building software systems that use SMS. We model existing practices in place. And in this case, what we were doing was swapping paper for phones. So we implemented a system in about 6 weeks. And you might ask, what can we do with SMS? You can do a lot. All of those malnutrition indicators fit in a single SMS message. And we pair that with a powerful backend software, graph it, map it, and you can get very amazing data from a very simple source. It also doesn't cost much because everyone already has their own phones. There's no hardware deployment. All we needed to do was train people and pay for the SMS messages, which fit the sort of budget constraints we were working in. So we deployed the system, and now the healthcare worker implemented it directly into their phone through SMS. The server grabbed it, parsed it, found any errors, graphed it, and mapped it real time, giving the government real data that it could actually use immediately without having to do any further analysis, identifying, pinpointing problems, regions that are having serious malnutrition issues. Also, our other agencies could use this on a global, local, and international scale, as well as to sort of look at comparisons between countries. Our greatest insight actually came from one of our developers' suggestions. He said, why don't we send a thank you message back to these community healthcare workers? They didn't even know why they were recording the data. They never got thanked. We said, wait a second. If we're sending a thank you message, let's send the diagnosis as well. Our servers have already done the calculations. So the next thing we do is we send a message back to the community healthcare worker with a diagnosis that empowers them to actually treat the children based on that, where previously they were using very inaccurate methods. So we turned a data collection system into a way to actually treat children and improve their lives directly. This project won the Net Squared Award by USAID and has been adopted for a lot of other countries now. We're doing all sorts of different things with SMS, tracking food, even teaching literacy in Senegal. And the real question, though, for us is how is this going to change the way UNICEF functions and works? Throwing software, throwing phones at problems doesn't really solve them. Can we react to real-time data? We're good at long-term strategy planning. What do we do now that we actually have real data that we can see and react to? If you'd like to learn more, there's information up on unicefinnovation.org, and the project is at rapidsms.org. The code, it's open source, it's on Python, it's out in GitHub. You can grab it, you can download it, you can modify it, add to it, contribute. There's an IRC room where the devs hang out, and thanks a lot.